Trying to juggle a busy schedule and take care of the kids can be a job in itself. So when you get a call from the school that your child is sick, it can be even more stressful getting a doctor's appointment right away. Well, tonight the 19 Solutions team shows you how school-based healthcare is helping parents and the community fix this problem.
Overwhelmed, tired.
Single mom of 4, Erica Talley is like many parents who sometimes face challenges just trying to raise their children. But for this Warren mom, a recent health challenge made everyday life even tougher.
Took out all of my hair, turned my skin, darkened my skin and my nails and my feet, made me very weak, had sores in my mouth and my nose. I went through a lot of transactions.
Erica, diagnosed with gastrointestinal cancer more than a year ago. She underwent 6 months of chemotherapy.
Couldn't drive, I couldn't do anything.
Erica's daughter, Janiyah, wanted to get a job to help out with the bills. In order to do that, she needed a work permit and a physical. But with her mom's illness, she knew she couldn't take her or her 3 other siblings to the pediatrician. But she knew there was a solution to the problem. Her school could help out.
She brought home this paper. She said, we have a nurse.
We're able to see kids for well visits, sports physicals, work permits, all those teenage things, as well as sick visits, kindergartners who needed vaccines and weren't able to get in with their primary care provider.
Nurse practitioner Allison Lance oversees Akron Children's Hospital's school-based health center in Warren City Schools. The district contracts the services with the hospital. The program is in 14 school districts and more than 100 school buildings across northern Ohio. Allison and RNs are employed by the hospital.
Allison was able to do Janiyah's physical for her work permit. She was able to get her job, and she's been working that job ever since.
Stick that tongue out for me, say ah.
Allison able to provide screenings and physicals for all of Erica's children. But when she was looking over her youngest son Jonathan's health history, something didn't seem right.
I was having pain in my lower back, my upper back. I was having bad migraines.
This lab work looks to me like sickle cell disease, and so within 10 minutes I was able to call Mom back and say the hematologist really does believe that this is sickle cell disease.
It's all amazing, especially being that she was able to find the sickle cell crisis with my son that I never was told about when he was a baby.
Allison's also able to communicate with her medical assistant with their school telehealth system. The assistant goes to other campuses, sometimes seeing more than a dozen students a day. Via computer, the two can exchange medical information.
I'm grateful for them bringing this program to the school.
Grateful. Erica Talley says knowing her children's education and health care needs are taken care of. Grateful that she's now cancer-free, able to focus on her continued recovery and raising her kids.
Not have to worry about, oh, did Joshua get his insulin, or did Janiyah get her physical, or did they get their shot? I didn't have to worry about anything. I was able to focus on my care, my doctor's appointments, my chemo treatments.
It is a wonderful program. Coming up at 6 o'clock, part 2, how one school district scrambled to get hundreds of kids vaccinated with its school-based health care, and how another is stepping up big time for the community.